Hello and welcome to our sixth webinar in the health implications of food and agriculture. Um, we will get started in just a minute. We have a few housekeeping items as usual to discuss, and we'll go through those while we wait for others to log on. It's good to know that this platform works best on Chrome, so any meeting works best when used with Chrome. If you're having any technical difficulties, I would suggest closing out all the browsers, restarting your computer, and then logging in again. We do have this webinar now continuing through the first half of 2020, so we hope that you will continue to join us and invite any colleagues that you want to recommend us to any upcoming webinars, which will fall mostly on the first Monday of every month, with the exception of some holidays when it will be rearranged to the following week. During the presentation, if you have any questions that arise, you can record them in the chat room area to the left of your screen, and we will make time to answer those at the end of the presentation. And lastly, of course, if you want to receive a CE certificate for participating today, you will get a presentation evaluation sent to you via a Google form after this presentation. Once you complete that, you will get a follow-up email which has a link to download and print the CE certificate. If anyone has any questions regarding the administration of that CE certificate, please email me at meganadelman@gmail.com, and that's MEGHANADELMAN@gmail.com. So I'd like to start by introducing Barbara Sattler, professor at the University of San Francisco, nurse, founding member of Annie, and continues to be a board member there. She's going to introduce the subject today of contaminants in our food, and our speaker, Renee Dufault, who we are very happy to have with us today.
Thank you, Megan, and I welcome all the people who have joined us for this webinar. We're delighted to have you. Megan is my partner in crime. We have been curating these webinars and initially just thought we were going to do about a half dozen, and our subject matter just keeps growing. There's so many things around food and agriculture for which there are health implications. And our idea was after the first few, we were going to begin to have an actual food and agriculture committee for the Alliance of Nurses for Healthy Environments. And that is something early in 2020, we're going to convene a committee which will allow us to have monthly calls where every one of you who have an interest in this will be able to join free calls, hour-long calls, so we can talk about a little bit of what we've been learning, but also what are the implications for us as nurses? What should we be doing differently? And we have an upcoming webinar where we're specifically going to have folks from Healthcare Without Harm who are going to talk about how can we take some of what we've been learning and apply it to bringing good and healthy food to our schools, universities, and hospitals. The Alliance of Nurses for Healthy Environments was initiated because of concerns about chemicals in our air, water, food products. And we have continued to expand so that we are now also looking at the health effects associated with energy. We have a number of nurses who live in areas where they're fracking. We also have had an interest in an abiding interest in climate change. And there are many aspects of food and agriculture that are implicated in climate change. On our last webinar, which is archived, we had somebody from the California Climate and Agriculture Network talk about the influences that climate change has on agriculture and the influence that various kinds of industrial agriculture can have on climate change. So we've been building our knowledge and hopefully developing some ideas of what we might like to do collectively as nurses. During our last strategic planning meeting of the Alliance of Nurses for Healthy Environments, which I am just going to call ANHE, as the acronym is ANHE, we decided that food and agriculture was going to be another area that we would begin to do a deep dive in, both learning as well as then thinking about what our actions might be. And so, as I said, for those of you who are interested in this, we'll be developing a food and agriculture committee early in 2020. There's also another emerging activity sponsored by Annie, and that is Drawdown, Nurses Drawdown. For any of you who have not heard about Drawdown, it's both a book as well as a project that looks at what are the ways, quantifiable ways, that we can make changes to help address climate change. And there are 5 different areas that the Alliance of Nurses for Healthy Environments is going to be using as part of Drawdown project. And one of them is moving people more towards plant-based diets. And so that will be another area that you who are on the call may want to join us to work on that whole project. So those are just some background to what Annie's up to and where there are going to be opportunities for you, not just to be learning, but also to be joining us as we develop policies and practices and collaborations with nursing organizations around the United States, but we also work with the International Council of Nurses and other nursing organizations around the world. So for today, I'm going to actually take a little time in introducing our speaker because I think her background speaks to both her commitment to public health and also the range of experiences that she's had that she builds upon. And I've known Renee for many years now, and I know her to be a very solid scientist and observer, and also somebody who brings a passion to really wanting to help make change, positive changes regarding the things that she's been discovering. So Renee served in the Army and also then served in the Uniform Public Health Service. She has degrees in in the environment from UC Davis, subsequent degrees from the University of Maryland, and a doctorate degree. She has served as an industrial hygienist, which is industrial hygiene is an area of public health that looks at exposures that workers have in their workplace, mostly to chemicals. And while she was in the Public Health Service, which is a uniformed service of the United States, she worked in several different major federal agencies, including working for NIH, the National Institutes of Health, the Environmental Protection Agency, Indian Health, and she's worked with Native Americans across the country on environmental health issues. And then her final deployment was to the Food and Drug Administration. And during her tenure with the Food and Drug Administration, she helped to oversee research on a number of things having to do with food contaminants. And one of the things that she discovered working with a collaborative group of scientists is that mercury is an unintentional contaminant that is found in high fructose corn syrup. And in fact, high fructose corn syrup is found in many, many processed foods. And she was trying to get this information out to the public, and the head of the FDA refused to let this science come to the public's eye. And she felt very resolute about wanting to get that information out and had to retire early from the FDA as the equivalent of a whistleblower in order to shed light on this information that would not have otherwise come to the public's eye. And for any of you who want to read a little bit more about that particular era, the magazine, the investigative magazine, Mother Jones, did an article about the work that Renee was involved in. She also has written extensively. She's written a number of articles, and two articles that I'm going to mention that you may be interested in. And one was, which has had over 150,000 viewers, looks at the gene and environment interactions regarding autism. And as we as nurses know, there's no clear smoking gun that tells us what causes autism, but she found some associations with some strength in their associations and wrote about that. She also wrote about mercury and type 2 diabetes among Native Americans, and she'll be talking about that today. And she is also the author of a book, Unsafe at Any Meal, what the FDA does not want you to know about the food you eat. It's a very readable book for any of you who are interested in understanding about contaminants in food. Unsafe at Any Meal should be a go-to book for you. And she also has a free online healthy diet tutorial. And I'm hoping, Renee, that you'll be able to direct us to that tutorial maybe at the end of your talk. And so with that, I introduce you to Dr. Renee Dufault. And I think you'll really all gain quite a bit of knowledge listening to her talk. So thank you so much, Renee, for agreeing to talk to us. And I see we have a great number of nurses on the phone to listen to you.
Thank you, Barbara. Can everyone hear me okay? Today we're going to talk about highly processed foods, and we're going to start with flour. But the idea is to, you've probably heard a lot in the news and different studies about how high food consumption leads to conditions like heart disease or diabetes, or but nobody talks about what
Renee, you're
Yeah, sorry.
processed food.
Hey, Renee. Sorry, this is Meg.
Associated with the development of these diseases. So that is what we're going to talk about.
Excuse me, Renee.
As soon as I can figure out.
Hello, Hi, Renee. This is Meg. We're having some interference with your I'm seeing that we're getting a little bit of.
I'm trying to get rid of the.
Wonder if we should.
Let me get rid of this video if I can figure out how to do that. Oh, stop the webcam. Okay, there we go. Can you hear me?
We are having some problems hearing you.
Hear me better now?
We are hearing you a little bit better. Do you have full bars in your?
Let me turn off the cell phone.
Okay.
I have. It looks like I have full bars.
Okay, Renee.
I just turned off my cell phone.
Great. Why don't you go ahead?
Does that help?
Go ahead.
Okay.
I think it's better.
Okay, good. All right. I'm sorry for that. Start from the beginning. Okay. So basically, we're going to talk about highly processed foods and why highly processed foods are the culprit behind many of these Western diseases that we're seeing. There's been a lot of publications lately that talk about the role of highly processed foods in, heart disease and diabetes, but they don't talk about what's in the highly processed foods. So that's what we're going to talk about today. And we're going to start with flour. And I'm trying to figure out, how do we get this slide? I want to be able to go to the next slide. Oh, there's the arrow. Good. Okay, here we go. All right. So, okay. So, with with regard to flour, you might not know this, but did you know that recalls are common? Every year, FDA recalls hundreds and sometimes thousands of 5-pound bag sacks of flour. In 2009 alone, there were 6 recalls, and 4 were having to do with unbleached flour, and 2 recalls were bleach flowers. So what makes flour unsafe to eat? Well, that's why they're recalled. When there's a flour recall, then FDA says it's unsafe to eat. The most common microbial contaminants in flour are E. coli and Salmonella. Bleach flour has fewer problems with bacterial growth, and you might want to know why, and we'll get into that. Probably the same reason why we bleach our laundry or our floors or surfaces. Bleach is a wonderful antimicrobial reagent. So here's the same reason why you bleach surfaces in your bathroom and kitchen are the same reasons why they bleach flour, to prevent bacterial infections like E. coli and Salmonella. That's an unofficial reason. The official reason is to speed up the aging process of the flour. If you bleach it, it has a whiter color faster. It's going to turn white as it gets older anyway, but if you bleach the flour, it gets whiter faster. And then if you bleach the flour, it also produces a softer texture. So the top 2 chemical agents used in the United States for bleaching flour are chlorine gas and benzoyl peroxide, which is made from benzoyl chloride, sodium hydroxide, and hydrogen peroxide. Provided the link to the FDA Code of Federal Regulations. I don't know if you have access to these references, but they're there. So chloralkali chemicals are used directly or indirectly as flour bleaching compounds. So chlorine gas, I've got that, that's a chloralkali chemical. Sodium hydroxide and hydrogen peroxide, all 3 of those chemicals are chloralkali chemicals. So chloralkali chemicals are made with mercury in some processes, and that's why we need to be concerned, because these chloralkali chemicals are allowed in bleaching flour, and they are known as mercury cell chloralkali chemicals. So chlorine gas is a mercury cell chloralkali product, and then the benzoyl peroxide can be made from mercury cell sodium hydroxide and mercury cell hydrogen peroxide. The problem with mercury cell chloralkali chemical products is they always contain trace amounts of energy, and that's a fact. They can't get it out. It's just a part of the process. So that's why a lot of mercury cell chloralkali manufacturing plants end up being Superfund sites, because the mercury gets in plumbing, it gets in the product, it goes in the wastewater, and in the air and the surrounding areas. So according to UN, there's 100 mercury cell chloralkali plants still operating worldwide. That's the United Nations. There are 4 mercury cell chloralkali plants in North America, 2 in Mexico and 2 in the United States. And you should know, if you don't know, that mercury is one of the most toxic elements known to man, meaning it only takes a little to make you sick or to impact your physiological processing. Who regulates the amount of mercury allowed in the chlorine used to bleach flour? Well, the Food and Agriculture Organization and U.S. Pharmacopoeia. They are the ones that have determined the monograph or the chemical specifications for the use of mercury grade chlorine. The Food Chemical Codex is the official rules, and they're produced by U.S. Pharmacopoeia now. They used to be produced by Food and Agriculture Organization, but now they're housed in U.S. Pharmacopoeia, which is located near FDA in Maryland. So this is the actual monograph or specification for the chlorine used to bleach flour. You can use 2.5 kilograms of chlorine for each kilogram of flour. And in that chlorine, you can have not more than 1 part per million mercury residue. So 1 milligram per kilogram of inorganic mercury can be in that chlorine. So here we see a lot of different on white foods, the pizza crust, the donuts, the Twinkies. These are all foods made with bleach flour, and they're considered highly processed foods. So the bleach flour products belong to the highly processed food group, and so we should define that. The definition of highly processed food is a manufactured product designed to have shelf life, meaning the product will stay on the shelf a long time without spoiling, no bacterial and so on, as a result of additives such as preservatives, food colors, or chlorine, mercury grade chlorine. Here's an example of a highly processed food, Fruit Loops, and it's made with flour, corn flour, and wheat flour. And also it has a number of food ingredients that we're going to talk about next. But the major problem with the processed foods that have what's full of different chemical ingredients is that they are a source of inorganic mercury exposure due to the use of bleach flour and other chemicals. Just to name a few, back there at last slide. For example, Fruit Loops has red 40, blue 2, annetto, blue 1, yellow 6, vegetable oil. All these ingredients are allowed to contain trace amounts of heavy metals and are known and found to contain trace amounts of heavy metals. So there are actually allowable heavy metal impurities in many food ingredients. Here we see a chart of food ingredients with GRAS, GRAS status, which this means that according to the FDA, they're generally recognized as safe and can be used without restriction by food manufacturers. So caramel, you see that ingredient quite a bit. It has allowable arsenic levels of up to 3 parts per million, lead up to 10 parts per million, mercury up to 0.1 parts per million. Calcium chloride, potassium chloride, sodium benzoate, lead up to 2 parts per million, mercury up to 1 part per million. Citric acid, lead up to 0.5 parts per million. So also other food ingredients can contain or are known to contain heavy metals, in particular mercury, corn syrup, high fructose corn syrup, and some vegetable oils. The United Kingdom came out with a report of various vegetable oils that had a risk of mercury contamination anywhere from low to high. So these are restricted use food ingredients, the ones that I'm talking about now. The ones in the previous slide are unrestricted use. You can use as much of them as you want to, food manufacturer. These have restrictions on the amount you can foods. And they contain allowable impurities, such as blue 1 can contain up to 50 parts per million chromium, 3 parts per million arsenic, and 10 parts per million lead. You don't see that very often, but you do see blue 1. Blue 2, up to 10 parts per million lead. Yellow 5 and yellow 6, up to 10 parts per million lead, plus arsenic, mercury. So you get the idea here. I hope you guys can see this slide. So these foods are restricted and they're certified. Every batch that's made by the manufacturer has to undergo a certification process that the batch does not contain more than the allowable level of impurities. Well, why do they even have these impurities in them? Well, because they're made from petroleum oils, and petroleum comes from the ground. And in the ground have all kinds of these elements. So in the United Kingdom and the European Union, those food colors on the previous slide all have to have a warning. If they're in food in those countries, they have to have a warning label affixed to the food package. So when we saw that Fruit Loops, if you try to sell Fruit Loops in the European Union or the United Kingdom, your package would say, may have an adverse effect on activity and attention in children. So that, because the science has shown us that clinical trial data has shown that these food colors have an impact on child activity and attention. So that we don't have that warning here in the United States. So by now, hopefully it's clear, you see that highly processed food consumption leads to heavy metal exposure just by the fact that, you know, so many of the ingredients found in highly processed foods, including the white flour products, have allowable levels of heavy metals. So in addition to the food ingredients discussed in previous slides, it is important to mention that high fructose corn syrup may also contain heavy metal residues, but particularly the inorganic mercury. And we know this because of the research that I did at FDA, where we actually I sent field investigators, FDA law enforcement officers out to the corn refiners, and we collected samples. And then we sent these samples for inorganic mercury analysis to several different labs, and all the labs came up with positive findings on most of the samples. And then, of course, FDA didn't want that information published, and that's why I had to retire to give the public this information, because it's not good for children to have exposure to the inorganic mercury. So those samples that we collected were in 2005, but I didn't get to publish those results until 2009. And at that time, you know, there could have been an argument from the corn refiners saying, well, those samples were collected in 2005. We don't use that process anymore. In fact, they did try to argue that. But so David Wallinga, Dr. Wallinga at the Institute for Agriculture Trade Policy collaborated with me on determining what products to take off the grocery shelves to ice for mercury. So we looked at all products with first and second ingredient high fructose corn syrup, and they put out this report, David and his group, of the different products that they found trace amounts of mercury in. And they were actually where we thought they'd be there was higher levels in foods with the first ingredient being high fructose corn syrup. And I knew this was going to be the case because when I worked for FDA, I had actually done a study with the military where we analyzed organic food products and food products that were not organic, that were more highly processed that had high fructose corn syrup, and we found the mercury was much more frequently found in those highly processed foods versus the organic brands that didn't have the high fructose corn syrup. So, of course, the corn refiners, they came out with a rebuttal. They didn't publish in a peer-reviewed publication, but they claimed that there wasn't going to be mercury in high fructose corn syrup or corn syrup anymore. So Canada went and took Canadian researchers and picked up products off of their shelves with high fructose corn syrup, and they also found residue in the products in 2010. And that was after 2009 when the corn refiners claimed to no longer use the mercury grade chloralkali chemicals in their process. But the fact is, later on I found out that they actually intentionally add inorganic mercury in the form of mercuric chloride to corn starch at the front end of the process, which when I was at FDA, I didn't even know that. So I learned more as time went on. So in 2012, we decided to find out how much mercury exposure we were getting from eating highly processed foods. So the EPA funded a study that I did with collaborators at Fort Peck Community College, an Indian reservation in Montana. And there were 2 clinical trials that were run, and we found, I'll share results with you. We tested the hypothesis in on process consumption, and we ran 2 clinical trials at the Fort Peck Community College. We had an online nutrition intervention course, lasted 10 weeks, and then we also had a corn sweetener elimination support group. So then we tracked the diet changes made by the students who completed the online nutrition course, and they significantly reduced their consumption of processed foods and significantly increased their intake of whole foods after 10 weeks. After 10 weeks of education, they learned how to read food ingredient labels and how to stay away from, certain foods. And then we also drew their blood before and after the study to determine changes in their biomarker status. Students in the online nutrition course who reduced intake of all processed foods and increased their intake of whole foods had lower inorganic mercury levels in their blood compared to the students who only eliminated high fructose corn from their diet. So what we learned was that there was mercury to be found in many processed foods, not just foods from fructose corn syrup. The one student who did not eliminate any processed food at all had the highest inorganic mercury level. In addition to lower inorganic mercury levels, students in the online nutrition course had significantly lower fasting glucose levels at the end of the trial. So my goodness, that was tremendously unexpected finding. We know that we were going to find an association between inorganic mercury in the blood and glucose. So that was quite a shocker, but it makes sense. Diabetes, glucose, that's associated with the intake of white foods, highly processed foods, including bleached flour products. So here, what we thought was, well, maybe we need more data because we only had a small handful of students doing this study. So we looked at NHANES data, and the data set was 16,232 Americans. And we confirmed the same relationship between inorganic mercury and glucose. So the more inorganic mercury in your blood, the higher your glucose. So that's what we found was type 2 diabetes is associated with inorganic mercury exposure from processed food consumption. which makes perfect sense, really, when you think about all the bleach flower, and the inorganic mercury exposure from the bleach flower and the white products and the food colors and all that processed food consumption. So here's some examples of processed foods, ingredients you don't want to eat. You sure don't want to feed them to your kids, because heavy metals are associated with neurodevelopmental issues. A friend of mine, Dr. Gilbert, Stephen Gilbert, and we wrote this article for Scientific American explaining why autism occurs more often in boys and girls and the reason why. And we used we analyzed a study that Harvard did as well as some other work. And the bottom line is that the cord blood in male infants has more mercury in it than the girls. So inorganic mercury, for some reason, is impacting boys differently than girls when it comes to autism. So heavy metals exposures from processed intake is related to heavy metals in the blood directly. Kahn et al. Heavy metal concentrations in foodstuffs eaten by adults and children match the metals found in their bloodstream, 2014. And of course, we published our findings of inorganic mercury directly associated with glucose levels in the human population and may be linked to the processed food intake. So yeah, the thing is, if the United States researchers don't want to follow up on this research or support more of it, we don't have to worry about that as human beings on the planet, because other countries are following up. They don't want to have the same Western disease problems that we do. So the problem as far as our children, the heavy metal relate to severity of social cognitive impairment. Children with autism have higher levels of mercury and lead in their blood compared to healthy children. No wonder, when you look at all the data, European Union and United Kingdom are telling parents, warning them to stay away from foods with these with lead and mercury. I mean, it's common sense. Hello, you expose your kids to these heavy metals, you're going to have ADHD and everything else. So the higher the heavy metal levels, the more severe the impairment. So here we are, another research group from another country took that on. Wu found that processed food intake increases exposures to mercury and lead, and is correlated to increases in I can't see on the slide there. Risk of ADHD. Yeah. So, do those warning labels in the United Kingdom work? Yes, they do. I did a review and I wrote this little ditty on how food labeling requirements actually explain the lower autism ADHD prevalence in the United Kingdom compared to the United States. So you might want to look at that paper. Here's a nice little chart that goes with what I found. So children with ADHD in 2016, USA 9.4% of kids, United Kingdom 1.5%. They get the food warnings. Prevalence of autism in 8-year-old boys, USA 11 per 1,000 in US in the United States, United Kingdom 4 per 1,000. In that side by side comparison of the data that was available. So here's the current U.S. SPED situation, not that current because this data was taken between 2005 and 2015, and I crunched the numbers for the last 5 years, but you can get it through the U.S. Department of Education. And what we're seeing, and I do teach special ed, I'm licensed to teach special, so I'm real interested in these numbers, is we've been seeing that as the overall SPED cases decline across the United States, over the years, we're seeing this tremendous increase in autism, 184% caseload autism. ADHD, 62% increase. And then developmental delay, 89% increase. And so it's not getting any better, folks. When I crunch that data, I can tell you it's not going to be any better because I'm in the classrooms now, and I can tell you it's not getting any better. So, you know, until we fix the food, we're not going to fix the neurodevelopmental issues. So, new article 2019 says that consumption of sugar, additives, pesticides, GM processed foods are hard to digest, may aggravate symptoms in children with autism, which is, you know, pretty clear when you see that these things can probably lead to increases in the heavy metal levels, right? We saw that in a previous study. So, by the way, benzoyl peroxide, which is one of the major flower bleach agents in the U.S., is banned in China. I find that very amusing. You know, that China's banned this terrible ingredient. So what can we do? Well, we have a free healthy tutorial online at the nonprofit Food Ingredient Health Research Institute. I also have a tutorial for teachers as well. So, you know, they're the ones who are going to be the parents. So the content has been successfully tested in 3 clinical trials targeting college students and or parents of learning disabled children. There's no one else that has a free tutorial online with movies and you know, activities and discussion questions. It's very so we're 8 months of instruction, 1 for each chapter in the textbook, which is the book that Barbara mentioned. Each module provides learning goals, reading assignments, discussion questions, 2 activities to meet the needs of different learning styles, kitchen cupboard surveys, food ingredient label reading exercises, videos, internet scavenger hunts, menu planning. Useful tool for managing diet while studying changes in biomarker status that may occur as a result of gene-environment interactions. I'm waiting for somebody to come and say, hey, won't you teach a course, and while you're teaching it, let's study the gene-environment interactions. Let's see if the PON1 gene levels are higher or lower when people change their diet. I mean, we could really do some stuff here, measure heavy metal levels, and you know, people don't realize the here and now. What we put in our mouth determines how our genes behave. It's called epigenetics. So when we taught the course to our parents, we had 22 in that clinical trial, and they all said they would recommend the tutorial to their friends and relatives. And all the parents changed their diet. So here's the book, goes with the free online tutorial. Here's the website, paperback, but the book is only 11 bucks now. I think it's real cheap. So, you know, nobody's getting rich off that book, I tell you. In Health Educator, the textbook is what is known as a tool of reciprocal determinism. It's an important construct in facilitating changes in behavior in health education. It actually helps the parent interact between kitchen and it's really the book's called Unsafe at Any Meal, What the FDA Does Not Want You to Know About the Foods You Eat. Okay? Unsafe at Any Meal, What the FDA Does Not Want You to Know About the Foods You Eat. The reason why it's titled that is because I had to retire in order to let the public know about the heavy metals allowed in the food supply. He knows this. Okay. So the textbook provides tables for parents to use while conducting kitchen cupboard surveys, so they can go through and look at all the things they buy. They can buy different foods. They can substitute. They can basically remove the unhealthy chemicals from their kitchen and replace them with healthy foods. It's very, very, very useful. So acknowledgements. The United States EPA provided the funding for 2 clinical trials for Fort Peck Indian Reservation. The American Indian Higher Education Consortium facilitated the study. The Fort Peck Community College and their students, they participated in the trials. And the institute that I run and founded hosted the tutorials on our website. And my personal family and friends funded the parent nutrition tutorial. So thank you to all those people who cared enough to try to make things better. So here's a few references. There could have been a lot more. If you read my papers, you'll find hundreds of references. There's hundreds of references in the book. Everything's backed by science. Yes, nutritionists do actually, there's a nutrition group that provides EUs. They actually took my book and they made a textbook. And the nutritionists can they buy my book and then they buy a workbook, costs $200 that. And so those are the people making the money. They use my textbook that goes with the workbook, and the nutritionists get CEUs for taking whatever that course is, and that's great. I've had kids come to me and say that they read my book in their nutrition class. So it's really awesome for me to feel like I'm making a difference. And I guess that's it. Let's see. Let me go to the side panel here. Attendee chat.
And this is Barbara, and I have a question too. If once you've looked through and answered any of the questions that the folks who are listening, please note that we apologize that we can't hear your questions, but there is that chat box that you can pull up, attendee chat, and we will read those. This is being recorded. We do apologize for the difficulty that you may have had in hearing some of Renee's words. Megan and I were arguing almost the whole first half of this as to whether we should just stop it so that we could do it again. We decided that we would continue on. We may at some point ask Renee to redo this so that we can have a better audio for you to hear. So once again, we apologize for the technical difficulties that we've had in listening and hearing every one of Renee's words. So Renee, were there other questions that that you see in the chat box that you want to answer? And if not, I can ask a question of my own.
I think I already answered them. The nutritionist community does study my book. They do use it in training to use. Book is they don't use my tutorial online. I don't know who, if anybody, I don't know who uses the tutorial.
Right.
We don't have a way of tracking. It's there free for any.
Sure. So there's been no official sanctioning of the use of the book by any of the American Dietary Association or anything at this point. So this is a kind of catch as catch can for those nutritionists who are interested. They can read this, but it's not necessarily a requirement. And so there are other questions here. They have a nutritionist at their facility here for a while. I'm concerned they are not aware of this. So perhaps this is an opportunity, Karina, for you to share this book with them, or maybe do some equivalent of a book club, getting a few folks to read it together and talk about it and what the implications would be for your facility. And I see that Jean Sandecki asked if you've attempted to get the course into public school systems.
I can only deal with Department of Education in Hawaii, and they like me to teach special education. They want me to teach the kids that are already damaged, and I do a real good job of teaching them. And I do have an online tutorial for teenagers on our website, and I made my 2 granddaughters take it, and they were not happy that I gave them cooking lessons and made them learn. But no, I don't have any way to make the schools adopt the information. I know that in Miami, they're working real hard to improve the school lunches. Hawaii passed a law saying that a certain amount of the food for the school lunches has to be low produced. And our cooks, we don't have, our cooks at the schools are not just opening boxes and feeding canned foods anymore. They're actually preparing meals from scratch. So, you know, by living and working where I do, I know I've made a difference and people are eating better. But I can't be everywhere. I can only be where I am. So
if I could suggest that this is the kind of thing that we are hoping to open up to fuller discussion when we can have people on a call together, which we'll be starting to do early in 2020. The implications, for instance, there are 40,000 school nurses in the United States. So getting this information to school nurses who could help advocate for changes in the dietary policies that they have there. And so there's another question by Valerie. Does your research look at the connection between exposure to heavy metals in processed foods, different factors such as racial and economic disparities? Do you think there are opportunities to integrate those into future research?
Well, if we had funding, we could do anything. But my little nonprofit, you know, we don't have funding and have never had funding. Everybody that does anything with us is a volunteer. So we have learned that the United States through NIH, the grants there, they don't want to do this kind of research. So you know, leave, let leave. I have learned after all these years that the system is what it is, and the people want to continue to do it the way they do it. We've tried to get warning labels on our foods. There's been people who've come together. You know, FDA had a little food color policy meeting, and we still were not heard. There were things that went on behind the scenes I happen to know about, and I can't say it publicly, but bottom line is there's no will to change the system. It has to be done locally at the community level. That much I know for a fact. So as far as policy changes from a national perspective, you'd have to get people from all the nonprofits working towards that same end, and I don't know that that would ever happen.
So this is Barbara, have there ever been any bills in Congress that would have helped to move us forward towards healthier food choices for our children in schools? I know in California, we currently have a bill that's calling for serving organic foods only to the students in schools. It's not likely to win this time, but it's definitely raising conversation at the political level within our state. Have there been any politicians, any people in the House or the Senate who would be sympathetic to this?
There could be. I don't know how, you know, I'm not privy of that process, but I think if the people who vote them in were interested in, you know, pursuing that, you'd have to get people riled up, and that means working a lot harder. I mean, people have to start cooking their meals at home and doing away with some of these convenience things. And we're talking about families that are already, a lot of them working, mothers and fathers are working, and we'd have to change the culture, Barbara. We'd have to change the culture. The fast foods and convenience food out in the 50s and grew into the market share that they're at now. And we're talking about a major cultural change.
Yes, and that's exactly what we're talking about. So it appears that that Renee has answered all the questions that are currently there. Um, it, I have two additional questions, and one is, uh, are there other scientific collaborators that are at universities that are doing any of this work, either in the United
No one,
States or in
I
Europe?
don't know. Yeah,
Okay,
in Europe, I think there's more of it going on. I've had more interest from Europe. Uh, I don't think the U.S. has been funding a lot of unique research these days. My understanding is grant money is really competitive, hard to get, and everyone I know out there in academia is struggling, especially in the environmental health arena. And this would fall into environmental health,
right.
preventive medicine type stuff. And this is not a priority for our country, has never been.
The other thing it seems to me is that given the um, proportion of children who are being born now who will have a diagnosis on the autism spectrum, as well as those children that about 17% of children have learning disabilities or developmental issues, that this is something that would be of great interest to parent groups as well. So perhaps as nurses, in our future conversation, we can think about who would we invite in the tent, whose voices would be meaningful, and who we could really work on a evidence-based argument for why we might need policy shifts. But as Renee has said, we also will need a cultural change as to how we relate to food and how we can bring healthier food options to our tables, especially for our most vulnerable populations, many of whom have, people working 1, 2, and 3 jobs at the same time. So another question by Janice, not strictly related, but what concerns might you have about the fire retardants that are currently being sprayed on agricultural crops in California? And I'm not sure that that is within Renee's sort of scientific domain, though it is clearly a concern that many have. Renee, do you have a comment on that? They're spraying.
Well, I'd have to see the material safety data sheet and find out what the chemical formula was on those retardants. And, you'd have to see, is it something that can be absorbed through the skin of the produce and, go from there. I mean, it could be a serious problem. They had actually concerns along these lines with retardants in New Mexico or Nevada or someplace when I was working many years ago with a tribe. So these retardants have been used for years and years, and they are always a concern when it comes down to the after effects, consequences.
Right.
So I don't know what to say about that.
So the work that's being done on the use by fire departments and those who are fighting forest fires where they're blazed down has been, the science that exists shows how it contaminates the water. I haven't seen anything about contaminating agricultural crops simply because it probably hasn't been studied. But as Renee has said, there may be some issues in it being on the surface of the crops. Additionally, if it's in soil, it may be something that can out of the plant and then become part of the actual crop itself. And this is something that we're looking at also vis-a-vis the fluids that are used in fracking that then get these wastewater fluids then get used actually in irrigating our Alps in the California Central Valley, where we have both fracking and at the same time. So fortunately, we have a lot going on. It appears right now that we're getting a little bit of mission creep from this particular talk. Carol is asking about microplastics in fish and harm to humans. And I think that we probably will want to have a whole separate set of experts who can talk about that, because that really is a whole other issue. And we'll see about perhaps doing seafood writ large and looking at some of the microplastics. Unless, Renee, you have something quick to say about that now.
Not on the microplastics, but I do have something to say about the mission creep. And my advice as a special educator, teacher, and you know, someone who knows an awful lot about the food supply is, and I see the schools are failing. You know, we're average graduate probably has we're lucky if they have 7th grade reading level, and so we're in big trouble if you don't know that already. So the bottom line is, as environmental health professionals, nurses or not, the bottom line is that if we are going to improve the intellect of our children, and if we're going to help learn better, then we need to get to those moms before they get pregnant. We need to have an aggressive nutrition education program. We need to have aggressive community gardening. You know, should be our focus, because all these little things like fish, the plastic in the fish, the fire retardant, the BA, this and that, those things can be addressed through the aggressive nutrition education program, the prenatal education, all of that. You can put that stuff in there. But to have all these groups out there doing single issue stuff, it's just like noise, you know. And if we're going to ever make it out of the big hole we're in the United States, we're going to have to start focusing on our neurodevelopment of infants before they're born, and on educating those young people that are going to be making these babies, if we're going to ever come out of this hole we're in.
Yes. Well, I think what you've given us is a lot of food for thought. And as a group of nurses who are evidence-based, we so appreciate how you marched us through the evidence. We also appreciate that your history in working for the federal government helps us to understand how much we sometimes how much is being concealed from us, and our need to really uncover more. In one of our next webinars, we are going to be speaking specifically on the issues of right to know, how things are being concealed, how we can really demand more transparency. And with that, I just want to thank you, Renee, on behalf of all the people that are in the audience right now, for a really great presentation. Once again, we apologize that the technology failed us a little bit here, so some of the words we missed, but I think there was enough interest. Your slides also gave us enough information to supplement whatever words we couldn't hear. And once again, thank you so much, Renee, and thanks to all the participants that have joined us today. The CEUs, I'm going to let Megan answer that question.
Thank you so much for having me. I appreciate it.
Of course.
Thank you, Renee. For those who missed my introduction, after this webinar, you will receive an evaluation sent to you by a Google form. Once you complete that evaluation, you'll get a follow-up email, which will contain a link for the CE certificate that you can download. If there are any problems in receiving that, please do email me at the email address below. I've written it twice in the attendee chat there. And if you just click on that, you can see it and copy it down. But I'll be happy to troubleshoot with you and make sure you get what you need after we're finished today. Thanks again, and we look forward to seeing you next time when we're going to be talking about institutional purchasing, food purchasing with healthcare without harm. Thank you. Bye-bye.